Good afternoon, everyone. Thank you all for joining us today. My name is Miranda Corton, and I will be helping with today's COVID-19 health briefing. Before we begin, just a quick reminder to any media who have joined by phone to please keep your phones muted until after all our presenters have done presenting. And once the briefing is over, we will then open it up for questions. Today, we will be hearing from County Executive Armand Buddish, Board of Health Board President Dr. Gregory L. Hall, Board of Health Board Member Dr. Sherry Dixon-Williams, and Board of Health Commissioner Terry Allen. We will start today with County Executive Armand Buddish. Thank you.
Thank you. Good afternoon, everybody. Happy New Year to all who are watching us. And I'm confident that 2021 really will be a happy new year, certainly better than 2020. That's because we have a vaccine. In fact, multiple vaccines. Even though we continue to face a significant and ongoing threat from the virus, the vaccines means there's an end in sight. Commissioner Terry Allen's going to address the plan developed by the county board, and I don't want to step on his report, but I do want to give you one simple message. When you're given the chance to get vaccinated, do it. Get the vaccine. Though it's very early in the process, we're already seeing way too many people saying no thank you. We're seeing in some cases as many as 70 or 80% of people who are offered the vaccine saying they don't want it. And that includes people in nursing homes. Those numbers have to be reversed. If we're going to get back to normal, we need most people to get the vaccine, not reject it. In particular, we're seeing a lot of suspicion coming from the Black community. And I will tell you, I understand that. There's a long history of racism from the medical establishment towards African Americans. In fact, it's part of our declaration of racism as a public health crisis that racism has led to worse health outcomes for Black residents. And historical atrocities like the Tuskegee study have created a very damaging and entrenched distrust. So I understand the concerns in the Black community. But the fact is that the virus is killing and sickening African Americans at a higher rate than whites, and this vaccine can change that. All of you, when offered a vaccine, just say yes. Our Board of Health is working diligently to administer the vaccine. They were out at the county fairgrounds and in other locations, and in the last 2 weeks, vaccinated 4,000 people. We spoke to some of the people who got the vaccine, and I wanted to share a short clip with you.
I got the COVID-19 vaccine because I'm a frontline worker. And I work with seniors, I work with those with intellectual disabilities, and I just want to make sure that I'm protecting them as well as myself and my family.
I'm hoping that we can start gathering again, we can see our families. I want to hug my friends again.
I got the COVID vaccine to help keep my family safe and my patients safe so that I wasn't transmitting any disease or getting the disease.
What I'm hoping for as we all get safer and take the vaccine in the community is that we can sort of get back into a normal rhythm where people are having more socialization.
It's a selfless thing to do for our community.
Personally, I want to be reunited with my family. I want to go places with my kids, but I want to see that for other people too. Very exciting.
We're working with community members and healthcare providers to get the word out to as many people as possible regarding the safety of the vaccine and when and where people can get it. Right now, the only limit is availability of the vaccine. As soon as the federal and state governments get it out to people, we'll get it into people. In the coming weeks, we'll be rolling out a larger messaging plan to help people understand the safety and importance of the vaccine. Even though it's not yet available to everyone, we want to make sure that when it's your turn, you'll feel that you're informed and comfortable saying yes. Okay, now to switch gears. This week, County Council and I received the first of 2 status reports on structural racism and its impacts on our community. The first report from the Citizens Advisory Council on Equity was extensive and contained their findings from many conversations with stakeholders and community members, as well as other research on local conditions and national best practices. First, I want to say that I appreciate the work that this group, and I plan on working with both commissions to find ways that we can be proactive in our response. One of the key recommendations from the status report is that all county personnel should take part in racial equity training, a training that's the same for all of us so that we are all on the same page with the same understanding. I plan on seeking bids shortly to make sure that we can get good training across the board. You can't make real change unless you understand yourself, your reactions, and your biases, no matter how unconscious that those biases might be. The status report also mentioned procurement as an opportunity for leveling the playing field when it comes to economic opportunity for minorities. Just this week, I signed a series of executive orders regarding our procurement process to make sure that the opportunity for minority-owned businesses to participate in county contracts is offered in a clear, timely, and accessible way. The county spends many millions of dollars in contracted services. I want to make sure that everyone who's qualified has an opportunity to work with us and to benefit. The executive orders cover things like making sure that everyone who's interested can easily know about the availability of contracts, making sure that the Office of Procurement establishes set goals for minority-owned businesses, and expanding our small business set-asides so we're helping more small businesses to thrive. We've done a lot in these areas over the years, but the results of our own disparity study, which we recently released, show that we must do more, and we will. The effects of racism run deep and reach into all areas of life, even our natural environment. One of the key aspects of our declaration of racism as a public health crisis, including making sure that people have safe and welcoming environments to live in. When we released our climate action plan, we recognized the need to reinvest in our tree canopy, understanding that not only do trees help manage stormwater, reduce heat where there's a lot of development, and reduce local air pollution, they also have a positive impact on people's mental and physical health. During our first round of funding, we planted almost 1,500 trees. And just as important, we were able to provide money and support to communities that needed to develop a tree planting plan. These plans help ensure that trees that are planted are local species and have the very best chance of surviving. Now, with our second round of funding, we anticipate planting thousands of trees, and we want to make sure that we're taking into account a community's overall needs. There are many neighborhoods and municipalities that simply don't have many trees, and that has long-term effects on residents' health and on property values. So as we go into the next round, I've directed the County Department of Sustainability and the County Planning Commission to pay particular attention to these under-resourced areas and to review locations through an equity lens. The tree canopy plan and its ongoing implementation will have a long-term impact on the people of this county, one that will last well beyond this generation, and it'll help promote our equity efforts. Finally, I want to talk about a transfer of power. No, not the one you're thinking about that's in Washington, D.C., although I could certainly talk about that too. No, this one was done respectfully and peacefully. I'm talking about the naming of the new president and vice president of County Council. Pernell Jones is the new president and Cheryl Stevens is the new vice president. I've worked with both of them over the years and respect and admire their commitment to our county and to making Cuyahoga County a better place to live and to work. Both Councilman Jones and Councilwoman Stevens care deeply, deeply about issues of equity, and I look forward to working with them as we all work to make life more fair and just for all the people of this county. Now, I'd like to turn the briefing over to Dr. Greg Hall, who's the president of Cuyahoga County's Board of Health. In addition to his private practice, Dr. Hall acts as the medical director for 4 urban nursing homes and is an assistant clinical professor at the Case Western Reserve University College of Medicine. Dr. Hall, it's our pleasure to have you today.
Thank you, Executive Fusions. It's wonderful to be here, and we're so happy that that your leadership has just been outstanding during this difficult time. I've been on the board of Cuyahoga County Board of Health for over 10 years. It's been a long time. It's been one of the highlights of my career because so much good is normally done sort of in the background with the Board of Health. You kind of don't know we're there, but we're doing a lot of critical work for a whole lot of people all across the county. And this past January, I was honored to be elected the board president. We've had an outstanding board who worked tirelessly. And in addition, you'll hear later from Commissioner Terry Allen, and the board is so happy to be represented by the staff and the leadership of the Board of Health and all their good work that they've done. But in March, we got met with sort of a growing pandemic, and so all the work that we did in the background sort of kind of came to the front, and we began meeting more often and strategizing and maneuvering and trying to determine what's next. Worried about masks and things of that nature, and we kind of got our stride again. We've been really deliberate about dealing with the information that we have. What are the facts? What does the science show? And as you guys know, when we talk about, I'm a physician, we talk about practicing medicine and kind of figuring out what the best approach is. That's what we were doing, and you saw that on the national level as well. And so we went through the summer, and then September and October, we started to get a surge. And then who knew that the president of the Board of Health, me, would get COVID? So I got it on the 18th of November, a week before Thanksgiving. I began to feel ill in the afternoon, and here I am coming down with a flu, right? Because I'm a physician, I knew it was COVID, but I've had the flu before. I've had a cold before. I went to bed, and in the past in my life, I went to bed and slept. I wake up the next day, I would normally feel significantly better if I just took a day and laid in bed. And so despite all that, everything that I knew about how dangerous COVID was and everything, I was pretty sure I had it. I was really sick with the flu, and I just went to bed and stayed there. And then after one day, I didn't get better. And another day, I didn't get better. And when people would call to check on me, I was sounding short of breath. And so they really had a number of texts back and forth to say, go to the ER. So I went to the ER at Cleveland Clinic, and they gave me some medication, some steroid medication. And so I felt significantly better. I went back home. And then I found out, even as a physician, we don't know everything. There was a recurrence on day 6. I got sick again, and I got sick with a vengeance. And I was back in bed again. Every muscle in my body hurt. Fever 103. Just sick as a dog. And again, missed Thanksgiving. I was sick Wednesday, Thursday, and Friday. And Friday, I said I need to go to the hospital. I've been sick already 8 days. I went to Cleveland Clinic. They took great care of me there. I was there for 4 days, and then they transferred me to the intensive care unit. So here I am, a physician at the hospital that I trained at, Cleveland Clinic, and now I'm about to go to the intensive care unit. And I know, that's not a good sign, right? And I wondered whether I was going to make it, to be honest with you. And now this is like the 10th day I've been sick. went to the intensive care unit. Thankfully, I only spent 3 days there, and then back to the hospital for another, to a regular nursing floor for another 4 days, very short of breath, discharged on oxygen. So here I am, normally perfectly healthy 59-year-old, and now I can hardly do anything without getting significantly short of breath. Thankfully I was discharged on oxygen. I got the remdesivir, which was the state-of-the-art treatment when I was in the hospital. But this is no everyday flu, and so here I am now, almost 8 weeks later, almost 2 months later, and I am still not back to normal. I'm about 88, 90% back to normal, but you may be able to tell I still can't breathe. If someone yelled fire, or if someone yelled that there was a gunman in the house, I'd have to go. I would not be able to run. I still haven't run. I do a flight of stairs, I'm short of breath. And so when people say they don't want the vaccine, and here I am 2 months later wondering, will I ever really get my breath back? Will I ever get to a point where I could run with my kids, or run up the stairs without really being real short of breath when I get to the top of the stairs? And people think, you don't want to avoid this. You want to avoid, missing 2 months, I missed Thanksgiving dinner, right? I still haven't had that dinner. And, so it's I make light of it, but it's really serious. And so if you have COPD, if you smoke, if you have diabetes, if you're significantly obese, if you have hypertension, which is significant of my people, African Americans have, you want to be proactive about getting this vaccine, because you don't want to get what I get. Because if you have problems and get what I got, I told a patient yesterday, if you get what I got, you'll be in a wheelchair on oxygen the rest of your life. And I'm still just barely off of oxygen. To tell you the truth, right now, I may end up being on oxygen the rest of my life. That's not my plan, and I'm still getting better every week. But it's important to know that you don't want to submit yourself to this virus. The vaccine, which I should remind, I got the vaccine 2 weeks ago as well, and so I'm being doubly sure I don't get this again. But you want to make sure you get the vaccine. If you get the opportunity, get it, and because it's just astonishing to me the way I feel right now, even not fully recovering from something that I caught before Thanksgiving, that people would choose to not avoid what I got. And obviously you all know the stories of, there are people that died. There were people on both sides of me in the intensive care unit. They were just coming and going, wheeling them out. And those people were dying. And so it's, this is a dark time, but the light is at the end of the tunnel, right? And I think the only way we can get back to doing like the people in that video shows, we can go back out to go to dinner and out visiting friends and back to hugging people again. Only way we can do that if we can get these vaccines into people's arms. It's not a conspiracy, it's just a fact. And people old enough to know about polio and smallpox, they were lining up to get that because they knew how deadly it could be. And so if we sit around and watch enough of this carnage, or enough of us get sick and we're all walking around on oxygen, that's no long-term plan as well. And so I think it's important. You need to consider whether you should get the vaccine. If you get the opportunity, you need to go and get it. You need to encourage your family members. If you're more in the older in the family, encourage them to get it. Encourage them not to listen to stupid conspiracy theories. We're just trying to get back to normal. We're not trying to do anything other than get back to normal. That's what everyone wants. And so right now, one of our great board members, Dr. Sherry Williams, who was actually the first person in the county to get the vaccine, or first person at Metro to get the vaccine. Was my partner in office practice 20 years ago. And now we're back together on the board. And I'd like to welcome and introduce one of my favorite people in the world, Dr. Sherry Williams.
Thank you, Dr. Hall. And I appreciate hearing your story. The part of the story, Dr. Hall, that you left out was that I was one of the people that texted you and said, get yourself to the emergency room. And
that's right.
That's true. Don't make me have to get your wife to tell on you. Yes, it's true. Because I am a pulmonary critical care specialist, and it has been one of the most heartbreaking things for me as a critical care specialist to basically witness so many people who have been sickened by this disease, and so many people whose families have been devastated by this disease. And many of you may have seen me become vaccinated. I was the first person at my institution to become vaccinated. And one of the things I said then, and I'll say now, is I got vaccinated for all of you, for all of the people in the community, patients, people I know, people I don't know, who need for the frontline workers to stay healthy and to be able to continue to care for them. I got vaccinated for my 80-year-old mother, who still calls me every day, and I talk to her sometimes twice a day so that she knows that I'm okay, because she was worried about me taking care of so many patients in the ICU. One of the things I want to assure people, because I see people in the hallways of my hospital, I see people sometimes in the streets or in the grocery stores, and they say, you were one of the people we saw on the news. We saw you on TV. How are you feeling? How are you feeling? So I want to tell everyone, I was vaccinated and I feel fine. I did not find that I grew horns or my ears turned purple or any of the things that people may be concerned about or people may have heard. My arm was a little sore. I had a headache. I took some Tylenol and I went to work the next day. In fact, I was working in the ICU and I continued to work in the ICU the next day. And so my point is that many times people have heard a lot of things or seen a lot of things. And I would encourage us to really and truly consider the source in terms of what we've seen, what we've heard. And as you consider the source, remember that there are a couple things that are true. The first is, as Dr. Hall mentioned, the same people, the scientists, researchers, people who have through the years been the people that delivered vaccines for smallpox, for polio, for flu shots. These same scientists and researchers are the people who developed this vaccine. And these are the same individuals who, through the years, scientists, doctors, researchers, who have studied disease and who really and truly have as their number one goal the health of the population of our society. And so, as was mentioned, I would just encourage us not to spend time sort of ruminating and focused and holding tight to conspiracies and sort of myths about things, and really get back to normal. And the way to get back to normal is through this vaccine. Some of the things that I've heard, I still have patients that I talk to on the phone as part of my pulmonary practice, my lung practice. And people ask me, besides, how are you feeling? People ask me questions in terms of things that have been on their hearts and minds. And I want to share some of those questions and answer some of those that patients have asked me. So people have said to me, well, you know, how do you know you won't have long-term side effects, Dr. Williams? You know, nobody really knows what the long-term side effects are. And I say to people, you know, you're right. This is a new vaccine, and no one knows for certain what the long-term side effects are. But here are a couple things that I say to my patients to consider. We're beginning to find out that there are some long-term side effects, at least for several months, following the COVID infection. As Dr. Hall has mentioned, many people are still short of breath. Many people are still experiencing fatigue. are still experiencing trouble with smelling, with tasting. So we don't know exactly all of the long-term side effects of the COVID infection either. We know that the vaccine prevents severe COVID disease. That's what we do know. And what we also do know is that severe COVID disease causes deaths. We have over 350,000 people in the United States that have died. And so I think I would encourage us to move away from myths and conspiracy theories and to embrace the things that we do know for sure in terms of lives lost versus lives saved. I also talk to patients and they sometimes say to me, well, you know, Dr. Williams, I probably will get the vaccine, but quite honestly, I'm trying to wait and see what will happen to other people. I would feel better getting it after I wait and see what happens to other people. And I said to my one patient, I said, well, I can understand that. I said, but let me again say to you that the same researchers and scientists that develop vaccines, actually, they studied this vaccine on 44,000 people. So it's been studied on quite a few, 44,000 people. And those 44,000 people were Black people, white people, people that are Hispanic, they were old, they were young, and I think it is a very, very good representation of the overall population. And so, although we may not know specifically those people, I think we can take comfort in knowing that those individuals basically represented the majority of us in society, in the communities that we live in. My patients sometimes say, well, that's all very fine and good, Dr. Williams, that 44,000 people were studied, but I don't know those people, and I know you. And I feel like because I know you and I got a chance to talk to you, that that's better. And I understand that too, that there's a certain comfort level that comes from knowing people and being able to talk to people and find out what their experience is. And so that's why I really am glad, I'm super glad that I'm getting an opportunity to talk with people and to have people see me and get a chance to, if they choose, ask me questions about how I'm feeling and what's been happening to me since I got vaccinated, because I'm a real person as compared to just a statistic of the 44,000 that were previously tested. Another question that many people in the African American community have raised, and we've talked about this before in terms of distrust. And, you know, I'll just say there's no excuse for what happened to us as Black people in terms of the syphilis trial or experiment, as many people refer to it. It was wrong. It was racist. It was absolutely something that is shameful in terms of having a therapy in that time period, penicillin, to treat syphilis and to not offer it to us as Black people, and to not do it because somehow we were not thought as being valuable or worthy, or it wasn't as important for us as for other people. That was wrong. That was racist, and it's shameful. I will say that Bill Clinton, when he was president, apologized on behalf of the government. And although that apology cannot completely make us all feel as though, okay, all's well that ends well, I understand that. I will say that this is an opportunity for us to have a therapy that will keep us safe. And I've had conversations with my patients where I say to them, you know, the problem with the Tuskegee study and the trial with syphilis was that penicillin was not offered to us. This vaccine is being offered to us as it is all of society. There's been somewhat of a slower rollout, but it's being made available to all communities in our society. And here's an opportunity, especially since we know that more of us as African Americans, Black people, are dying at a disproportionate rate from this disease. Here's an opportunity for us to have effective prevention. And the best defense is a great offense. And so I would encourage us to be on the offense. As Dr. Hall has pointed out, even though he has survived this COVID, and even though he is much, much better, and we're thrilled that he's better, we were missing our president of the board, he has still had challenges in recovery. And so we would encourage people not to put themselves in that position. As I mentioned, the best defense is a great offense. Don't put yourself in a position to have this disease. If you can get vaccinated, if it's offered to you, please do. I am scheduled for my second dose, and certainly if I get an opportunity to talk to all of you again so that you can see how I am after my second dose, I would love to do that. But rest assured that all is well with my colleagues who have gotten 2 doses of vaccine. There are many people in the trials and throughout the communities who have gotten 2 doses of the vaccine and have done quite well. So with that said, I want to thank Executive Buddish and introduce our Commissioner of Health, Mr. Terry Allen, who has, through his tireless efforts, led the Cuyahoga County Board of Health in tackling this pandemic. And I really appreciate you, Terry, and the entire staff for all that you do for the community. And with that, Terry Allen.
Terry, if you can hear me, you are muted.
Thank you. I was supposed to take care of that myself, Jonathan, and thank you for the reminder, Miranda. So I just to start over, it's been my distinct honor to work with Dr. Hall and Dr. Williams for many years. They, as you heard, go way back together, and their distinct expertise, each of them complements each other, as do the other members on the board. We have folks who have specialties, and board members defer to each other around those issues. And so I've been really fortunate to work with wonderful board members that are really committed to community service. And so it's an honor for me to work with both of them. And what I think we saw today was the courage and the leadership demonstrated by both Dr. Hall and Dr. Williams, sharing their stories and their experiences and their commitment to getting vaccinated. And I think it's important that folks hear from the experts, and they hear from people that they can relate to as they make their decisions around getting vaccination. I have a brother who is a paramedic, and so we've been doing lots of vaccinations in the community, and he had the opportunity to get vaccinated. And he said, should I get vaccinated? And I said, yes. And he asked me why. And I said, well, do it for mom and dad. And so he said, okay, and got vaccinated. So I think we either hear from friends or family and make decisions around getting vaccinated. We wait and see sometimes how others do with the vaccination and decide to go forward. But we have reasons why we may determine that we want to get vaccinated. But I want folks to take a moment to remember the experiences that Dr. Hall shared. And he's still dealing with the aftermath of COVID-19. And that's a pretty powerful message about the importance of protecting yourself and those around you and the responsibility we have to do so. So I thank them both for taking time, and their courage and leadership are palpable, and we look forward to hearing from them more as we move through this process. So with that, I'm going to move into some talking points, and then we'll be covering our weekly briefing as well. So on December 23rd, the Cuyahoga County Board of Health began our COVID vaccination campaign. We're glad to be joining our partners in healthcare and in the federal pharmacy program. It's CVS and Walgreens and others to focus on the first wave of those identified for vaccination in Ohio's phased approach. COVID-19 vaccinations are currently focused on phase 1A recipients, and those include healthcare workers and personnel who are routinely involved in the care of COVID patients, residents and staff in nursing homes, residents and staff at assisted living facilities, patients and staff at state psychiatric facilities, and people with intellectual disabilities and those with mental health illness who live in group homes or centers and have staff at those facilities, as well as residents and staff at Ohio veterans homes, and of course our EMS responders. So this Group 1A in Cuyahoga County is very large. We know that 20% of our healthcare, our workforce is healthcare in our community alone. So if we think of our urban counties around the state, we're talking about a huge swath of folks that are particularly at risk. They are our frontline workers, our defense in the system where folks go and seek care, and we count on our hospital systems to be there for us and the healthcare workers to be there for us. So protecting them makes good sense. Consequently, it could take, by some estimates, well into February, deep into February, to address the full Group 1A for vaccination. So to date, we've received 5,600 doses, and we do have clinics scheduled next week. We've had a number of clinics scheduled right along, both at firehouses. We did clinics the week after Christmas at firehouses in Independence, Shaker, and Westlake. We've had several points of dispensing, or pods as we call them, at the county fairgrounds, and we're also going to be identifying some additional sites east, some anchor sites out east as well. But we also have a mobile team of physicians led by our medical director, Dr. Heidi Gullett, preventive medicine doctors working with her, and they've been working in adult care homes for those that are developmentally disabled to provide the vaccine, because many of those folks can't move around. It makes most sense to vaccinate them where they live. And so those in other congregate settings are areas where they're focusing their work. So I want to take a moment to thank all of them, our staff in particular, who continue to play defense on case investigation and contact tracing, and cluster investigation and data analysis and answering countless phone calls on top of their normal work that we do in public health. And all of our partners at the Cuyahoga County Emergency Management Agency, who have helped to coordinate emergencies and response going back to post 9/11 response around anthrax and smallpox and Ebola and H1N1. Over many years, we've had a strong relationship, and they're very critical to us. So we thank Executive Buddish for his support through the Emergency Management Agency and the Emergency Operations Center. The Cuyahoga County EMS providers, as a son of a fireman and a brother of a paramedic, these folks have been fantastic in their work with us to respond and help us vaccinate all those folks in the 1A groups. And we're very thankful, as well as nurses coming from the Francis Payne Bolton School of Nursing at Case Western Reserve University that have been there to support us. And our community volunteers, our community emergency response team, or CERT members that show up whenever we call to help out in response. So it's been quite an effort, and it's wonderful to watch in the process, see people rally around their community. Their commitment to partnership and serving all of us has been inspiring to me. So the Board of Health has created a new web link where people can pre-register for the Group 1A we mentioned, and that's at www.ccbh.net/vax, or VAX. I'll repeat that. www.ccbh.net /VAX, VAX. And so that link will be updated regularly. So please check out that link and you can register, pre-register for a vaccine. So we appreciate your patience as we move through that important process. If you're a member of a Phase 1A group, you'll be given an opportunity to sign up for one of our upcoming points of dispensing or pods as vaccine is available. We're also working through a long list of eligible agencies to reach this very large number of people in Group 1A. If you're a member of the group and you receive a link because you're on a sign-up list, you'll complete a pre-registration form in order to schedule a date and time to receive the vaccine when it's available. All individuals who sign up for vaccination will be required to verify that they're a member of the eligible group and required to comply with several requirements. Complete the aforementioned survey through a sign-up link. Formally attest that they're a member of the eligible group, and we want to make sure they provide identification for who they are and also proof that they're employed with the agency that is the healthcare agency that justifies their 1A designation. If folks don't meet this criteria, you may currently not be eligible for vaccination. And as other groups become eligible for vaccination in subsequent phases over time, more information will be shared with the community. It's important to note also that the Duke Global Innovation Center reminds us just how fortunate we are in the United States. Many countries don't have access currently to the COVID-19 vaccine and may not have access till 2022 or 2023. We may have to wait for weeks or maybe months to get vaccinated through this process, depending on where we are in this phased rollout, while many around the world may wait for years. We thank everyone in advance for their patience and understanding and appreciation in this unprecedented global vaccination campaign. So just yesterday, Governor DeWine announced that those in Phase 1B will be able to receive vaccinations on Tuesday, January 19th. And those 80 years of age and older will be prioritized first in this next phase, roughly totaling 120,000 Ohioans. Ohio is expected to receive 100,000 doses during the first week of distribution for Phase 1B, and those doses will be divided across a range of providers in the state. Governor DeWine said that with up to 420,000 people 80 years and above and only 100,000 doses available in the first week, it will take several weeks to vaccinate those 80 years of age and older. So Phase 1B will take a few weeks and a lot of coordination and distribution overall. Vaccines for Ohioans over 80 years of age and older will be administered by physicians, local health departments, hospitals, federally qualified health centers, in-home health service providers, and some retail pharmacies. So the vaccine, those 100,000 doses, will be spread across a range of providers, expanding places where people can get vaccinated in the 1B group. And as of today, the Ohio Department of Health has 1,700 providers registered to distribute vaccines. You know, it is certainly the goal here that over time that the COVID vaccine is available like the flu vaccine in many places in the community to encourage as many people as possible to get vaccinated. The Ohio Department of Health is holding webinars for providers here in the coming days to help to describe how this rollout will take place. So we'll be anticipating that information soon. Governor DeWine anticipates that vaccines will be available for those 75 years of age and older beginning on March 25th. The following week, vaccinations for those 65 years of age and older. So I want to pause and make a couple notes here. We look at our most recent census data that from 2019, the estimates show that there are 230,000 people over age 65 in our county. So this is a very large group, and patients will be required, and certainly those most at risk for complications and fatalities are in this age group. And so it's an important step. As we go forward, the week of January 25th, there'll also be vaccinations for Ohioans with severe congenital, developmental, or early onset medical disorders, and there'll be additional details forthcoming on that. The governor also announced that on February 1st, vaccinations will be available for personnel in schools, in the Ohio schools, that's K through 12. The Ohio Department of Health will send forms to the superintendents to indicate their plans to go back to in-person or hybrid learning by March 1st, and indicate the number of staff they believe will choose to take the vaccination. And we've been working, as I've mentioned multiple times, for many weeks, basically once a week since back to last year's graduation with our school districts, and spoke with them this morning about beginning to plan on how we would address vaccinations in the school community, which is very large across 32 districts in Cuyahoga County. So what we have before us, I think, is a very daunting task, but certainly something that we embrace. I was out yesterday. We were talking earlier with Executive Buddish that we were out yesterday for 13 hours working at the fairgrounds to vaccinate folks, and we vaccinated almost 1,600 people in just the last 2 days, and over that time. And it's great to see the vaccine being distributed. It motivates you knowing that that is our pathway through this pandemic. So with that, I'd like Jonathan to, if we could, to switch over to our data brief as we move forward and close out here on our updates. So you folks are familiar with our brief, and so if we look at the data here in our case overview, looking last week, we had over 50,000 cases and 3,130 hospitalizations, and of those, 650 ICU admissions. And so certainly Dr. Hall can relate to these numbers and understand them. He is a living, breathing epitomization of the impact of this virus on our community. And sadly, we've had 1,180 fatalities. And a bright spot, of course, is closing in on 43,000 people have recovered. So we're glad to see that. So what we've really been talking about is this combination of offense and defense in the community. The defense is our work around case investigation, contact tracing, cluster investigation, even as we move to offense to deliver vaccines. So this is the world that we're living here in public health, and it'll be that way for quite some time. We're not out of the woods yet. If we look at our weekly trends, our case report numbers are down right now from the previous report. We also know the holidays have had some impact overall on our case numbers. As you'll see in a little bit, the number of folks tested has dropped, and we think that ties both to folks now thinking about vaccination, but then also the holidays have probably deterred a bit some of the testing that was happening previous. But folks will see as we go forward that COVID-19 is very much still a big problem in our community, and is surging. And we've seen an increase in deaths over the previous week reported. We are still red, or the level described in the public health advisory system. We are still in the red level here in Cuyahoga. So if we look at our demographics as we move down, Jonathan, around the page, you'll see that 45% male and 55% female. And the age groups have been fairly constant in the bar graphs there. You'll see that our largest group continues to be 20 through 29 year olds, and many of them also are, because of the way they move around the community, can be drivers of cases. And at the very end of the graph, you'll see that we have most of our fatalities are occurring in that 70 plus age group. And certainly that justifies, really, if we go forward from 65 forward, why we're focusing on that age group as we begin to prioritize into 1B. We see our race data where 56% of the cases are white, 23% black. We have 13% of folks where we don't have that data. We did not receive that. There is a 2% Asian, and 7% would incorporate other Hispanic, Latino, and other races. You'll see that 9% of healthcare workers account for the cases. To date, that number has dropped over time. I think the hospitals certainly have done all they can to prevent exposures in that environment. We have our race and ethnicity data in that bottom graph, where we have about 71% non-Hispanic Latino and about 3% Hispanic Latino, and about 26% of people have pre-existing conditions. If we look at the race data, we'll see that about African Americans are about 1.4 times more likely to be a case of COVID to be diagnosed, over 2.7 times more likely to be hospitalized, and more likely to die. And so certainly these inequities perpetuate and have been known for many decades in diabetes, late stage cancer diagnosis leading to higher rates of fatalities, asthma, heart disease, a whole range of chronic diseases. And so this is yet another example of racial inequities in health that we're demonstrated in our society and need to be addressed. If we move down and go to our epi curve, you're familiar with this. These are red bar graphs by day, starting from way back at the beginning of the pandemic on the left going forward. And you'll see this huge surge that we're still amid in Cuyahoga County, those red bars. And we watch those very closely. We have seen a bit of a drop, but some of that relates back to the holidays, and we need to see what happens next in the coming days and weeks. But we really believe through March, we have to maintain that vigilance going forward. If we move down, you'll see the zip code map, and these have been fairly stable across. This is a map we put together with the Cleveland Department of Public Health, and these numbers have been fairly stable in terms of distribution for many weeks. So we'll move to the last page, and these are the numbers we watch closely and why the hospital vaccination campaign makes sense to be first. You'll see here with the gray line, our critical care beds, our ICU beds are at about 80%, and our adult medical beds are at 79%. That has fluctuated, but we are still up from where we were, way back in March. And we watch those numbers because we don't want to be stressing the system. And certainly healthcare workers getting sick with COVID, it can affect the ability to staff all these beds that are available. We've seen a slight drop in ventilator utilization, that yellow line, but an increase pediatric medical beds that have occurred, but they're both at 45%. What we're seeing next are some very, very concerning data around our testing for COVID. And so as we move down the page, you'll see here the next two pieces of information relate to hospital testing and nursing home testing. And so if you look at the bottom, you'll see over the last week of data we received, overall the number of tests in hospital systems has dropped by about almost 15,000, or a bit more than 15,000 since the beginning of December. And our positivity rate is at 24.2%. We're approaching 1 in 4 people tested are positive. So we need to understand what that means. Just because we saw a drop in testing, that could mean also there's lots of people out there that haven't got tested, that maybe think vaccinations are here and they don't need to be tested. What they need to understand is this risk is very real, and they need to protect themselves and others around them, and remember that vigilance, hanging on here for just a few more months until the spring, is essential, because we want to limit the heartbreak experienced already by this pandemic, because it's still very much a big threat in our community. Lastly, this number around nursing homes, which is why that is a concentration for vaccination, is almost still at 18% of those tested. So very, very high numbers. And so we're concerned about making sure we play offense and defense here in the coming days and months. We're excited about the vaccine rollout and hope that those number of doses increase. Glad we have more partners joining us to distribute vaccine in the community. And so things are looking up, but we also have to double down in the next couple months here around our prevention measures, because we want to close out strong, as Dr. Williams has said to us before. And given that we got a big game coming up on Sunday, it's appropriate. We don't want to fumble the ball on the goal line. So there you have it. And with that, I'll turn things back to Miranda for questions. Thank you.
Thank you, Terry. We will now open it up for questions. So if any members of the media on the line have questions, please unmute yourself and go ahead with your question. Thank you.
Good afternoon. This is Courtney Estalti with Plain Dealer in Cleveland.com. I wanted to address something Commissioner Allen brought up. You had mentioned that it might be well into February before Cuyahoga County gets through the full 1A group. And I'm wondering, with Governor DeWine's target date of January 19th for 1B, how will that work? Will 1B have to wait in Cuyahoga County until you guys are all the way through the 1A group? Does it push that back so that 1B people, it's going to take longer for them to get it here?
Thank you for your question, Courtney. So what we're looking forward to, we know we have early next week a webinar set with other providers to strategize about just this question. So Right now, the 1A group, if we look at those folks and who's taking care of them, we were glad to hear that home health will be getting vaccine, because home health was certainly part of that. So you've got residents that are certainly fragile that those folks take care of. They're 1A group members. And so if they're getting vaccine here in the near future, they can help out with that proportion of the work. We know that the pharmacies have been working through nursing homes and skilled nursing facilities, a range of long-term care sites, and hospitals have been vaccinating their staff. So we're hoping going forward, as we add hospitals that are participating with us going forward, pharmacies, federally qualified health centers, we have a webinar with these providers to talk about how we strategize this bridging of 1A to 1B. So in the urban counties, Cuyahoga, Hamilton, Franklin, Montgomery, for instance, this is a huge task, and with 100,000 doses being rolled out, as the governor described, across the state, we have to take into account that demand will clearly outstrip supply for quite some time. So prioritizing within those groups in 1A and even in 1B around, for instance, we think about those with chronic illnesses being particularly at risk among those 65 and older. And also even within the school systems, people who are older that have chronic illness could be prioritized because they're most at risk for complications and certainly for risk for fatality. So I would imagine those will be among the strategies that are going to be discussed next week as we decide how we will bridge 1A and 1B, particularly in urban counties. Some places downstate in rural areas, they may very well be able to move to 1B now because the populations are smaller, but certainly they're less vaccine available. So those are a few ideas that we expect to hear about next week to address some of the specifics of what you asked.
Thank you. And I guess I'm just wondering, you guys are working on bridging that gap and that strategy. Does the final say rest at the county level, or will the governor dictate to that to you folks?
Well, I would say, according to the governor, has given some latitude to work through those at the county level. We, as I mentioned, the Emergency Operations Center, and the governor spoke to this, in every county serves as a nexus point to bring us all together. We did it with H1N1. We used the Emergency Operations Center with Ebola for communication coordination. And the goal ultimately is that in the way that the state coronavirus website has a listing of all the testing locations for COVID on the site, and then you can then connect with them on the specifics of testing and appointments and the like, that we're going to be building basically a site at the state level that will be populated with places where people can get vaccinated. They may require appointments, certainly, and there may be specific age groups they're focusing on, but the Emergency Operations Center will be a place for all of us to come together in our community here in Cuyahoga to make sure that we are working hand in glove. And in every emergency I've been involved with for the last 30 years, all the partners come together to respond on behalf of the community in a way I think that is always very powerful and effective. And so I would anticipate that there to be some local latitude to make those decisions around how to best use the assets and capabilities of each one of those agencies to best serve our community and get as many shots in the arms as we can.
Okay, so the answer there would be you expect it to be a collaborative decision between locals and the state?
Yes, I think that definitely would be the case.
Thank you.
Sure.
Thank you. Are there any other questions?
This is Lisa Ryan from 90.3 WCPN Idea Stream, and I'm wondering if you have any data on the demographics of who's getting vaccinated in Cuyahoga County, and if it is like a disproportionate number of white people getting vaccinated, what are you doing to try to make it more equitable?
That's a very good question, Lisa. Off the top of my head, I'd have to go back and I don't know, but I think it's a very important question. So we'd like to follow up with you on that. I'm looking over at Kevin. We'll have to come back on that question and understand that. Certainly that is a very, very important question. And it helps us then to decide how we focus our work going forward to make sure that we close gaps to assure that we have equitable distribution Our work that we've done with Metro Health around testing was designed to do just that, to bridge those gaps, testing, working with the Greater Cleveland congregations and assuring that testing was widely available, particularly in communities of color. And so that is certainly our goal going forward, is to assure that those that want to be vaccinated can be vaccinated, and that everybody has an equal opportunity for a COVID vaccination if they wish. So give us some time, we'll follow up with you on that.
All right, thank you. I look forward to hearing from you.
Any other questions? Okay, I think that wraps up our briefing for today. So thank you, everybody. Please stay safe and have a great weekend.
Thank you.
Thank you.
Thank you.